time for this morning's health segment. May is National Stroke Awareness Month, and here in Western New York, the incidence of stroke is 23% higher than the national average. Right now, we're joined by Dr. Greg Boucher. He's the director of the Medical Rehab Unit at Mercy Hospital within the Catholic Health System. You're going to tell us a little bit more about how you can recognize the signs and symptoms of stroke and also how you can prevent stroke from happening in the first place.
Well, stroke comes about usually because of certain medical conditions such as hypertension, diabetes, cholesterol, obesity, physical inactivity. So first and foremost, you want to do yourself a favor and try to prevent those from occurring through good medical care and prevention through your lifestyle as well as through your primary medical doctor. Also, if you have those risk factors, and you want to maintain them once again through lifestyle changes or maintenance. Smoking is a big issue as well for people, cardiovascular disease as well as stroke.
And why is the incidence so much higher here in Western New York than elsewhere in the country?
Well, I think we have a relatively older population, and most strokes occur in people who are over the age of 65. Also, because they're older, they may have many of these medical conditions that we're talking about, and also a lot of it has to do with lifestyle, lack of exercise, poor eating habits, and a general perhaps not maintaining their medical conditions so that a stroke does not occur. And in fact, it's 25% greater than the national average. It's actually in New York State, it's 80% greater than the rest of New York State in Western New York.
Okay, so if you're having a stroke, what are some of the symptoms that are going to tell you that that's what's going on, and what should you do?
Well, a quick onset of weakness, slurred speech, difficulty walking, visual difficulties, balance, so all related to a neurologic problem. And so if you have these signs and symptoms, the first thing you need to do is, either call 911 or get yourself to medical care through the ER, or even call your primary doctor, and they can advise you appropriately. Because the more time you wait, the less likely you're going to get the appropriate treatment to hopefully reverse the effects of what may be a stroke.
How long does a typical stroke last? Are we talking seconds, minutes?
Well, the stroke can last, it's a matter of trying to intercept the effects of the stroke. So if somebody's having a stroke, you want to present to medical care as soon as you can, because through the ER or neurologic attention, they can provide you with medications and treatment that can interrupt the effects of the stroke, and as a result, the neurologic consequences can be eliminated.
Okay.
So it's a matter of just how quickly can you come to that care, and usually a 3-hour window is what they talk about in terms of getting to medical attention.
And the rehab after the stroke occurs is also equally as important in your health later in life. Well, that's about all the time we have right now, but you have an event coming up soon where you're going to be able to share much more information with people.
Yes, the rehabilitation is if you have a stroke and the neurologic consequences, how can you rehabilitate to get back to some functional independence, and that's a big effort of the rehab unit as well as family, and it's a big process. It's a lot of work, and we're going to be talking about that on Monday with our session, myself and Dr. Peter Kinley Quinn from Mercy Hospital.
The workshop will be taking place Monday at Lucarelli's restaurant. You can call the number on your screen if you're interested in registering for it or finding out any more information.